Hello and welcome to this short presentation on nursing interventions, so implementing your patient care plans. So when we talk about nursing interventions, we're talking about anything that has a therapeutic benefit for the people in which we're looking after. So this can be medication, it could be activities, it could be social prescribing, it could be how to deal with an incident, how to manage one of their symptoms, how to manage their disease or their illnesses. So that's what interventions are. They're blocks of instructions or advice and guidance. So that's roughly where we're going to go with this. So in here, you need to understand the models of nursing interventions, and you need to understand nursing intervention categories. So nursing interventions, to provide quality patient care over a period of time, nurses need a roadmap that guides their actions and quantifies desired outcomes. As a registered nurse, you will need to be responsible for creating a plan of care based on each patient's needs and health goals. A nursing care plan is a formal process which includes 6 components: assessment, diagnosis, expected outcome, interventions, rationale, and evaluation. Documenting these steps ensures effective communication between doctors, nurses, and other healthcare professionals over multiple shifts. So what we're saying here is this isn't this kind of formula is part of that person to care planning bit, but goes a bit more deep now. So we're looking at those assessment tools that we learned in section 1. We've now learned about all different health conditions and the different things in which we need. So for example, we saw epilepsy, we saw those clear steps on what needs to be done. Interventions are key elements of the nursing care plan. This is a guide. This guide explores nursing interventions and their roles in patient care. Nursing interventions are actions that a nurse takes to implement patient care plans, including any treatments, procedures, or teaching moments intended to improve patient comfort of health. So actions can be as simple as, these actions could be simple as adjusting the patient's bed and reducing and changing position, or as involved in psychotherapy and crisis counselling, while some nurses' interventions doctors ordered, nurse practitioners can also develop using principles of evidence-based practice. So common nursing interventions include bedside care assistant, medication administration, support, feeding assistance, monitoring, and vital signs. So when we look at those, we can think about, we know what all of those are within our roles, and any of those are things that we're trying to do to achieve desired outcomes. So for example, bedside care and assistant could be turning charts, pressure relief while somebody's in bed. Administration of medication is that we'll make sure that your medications are given on time. This is going to be done by. Feeding assistance could be, to promote independence or just to maintain nutrition, hydration via the muscle, etc. And again, monitoring vital signs could be done hourly or 4-hourly or as and when prescribed. Nursing interventions are grouped into 3 categories according to the role of the healthcare professional and in patient care. We look at independence. So this is, as a nurse, we can perform independent interventions on their own without assistance from other medical personnel, e.g. routine nursing tasks such as checking vital signs. Dependent, some actions that require instructions from doctors or prescribing new medication. And interdependent, this is a collaborative and independent interventions involving team members across multidisciplinary things. And we looked at group work in there. And this could be things such as supporting people to eat or drink, physiotherapists or occupational therapists. In the role of the assessment, the nursing assessment is the first step of a nursing care plan. During the assessment process, both physicians and nurses might ask questions and perform tests to gain information about patient's health and the state of being professional gathering information for the patient. So in other words, we take vital signs, we look at physical complaints or concerns, what they're telling us, external body conditions, that's the observation of the body. We can look at their medical history and their current neurology functioning, so their competencies. The role of the assessment: after gathering all the essential information during the assessment process, the nurse can use clinical judgment to formulate nursing diagnosis lists based upon the assessment and diagnose. The nurse can develop a care plan that outlines interventions and include, for example, the nursing diagnosis list may conclude the patient has a lack of appetite due to post-surgery pain. For the medical diagnosis, the nurse can set goals to resolve patient's pain through actions such as administering pain relief or the assisting the assessment of pain levels every few hours. So the nursing intervention classification system: there are several types of nursing interventions aimed at meeting the variety of medical needs and conditions of patients. The nursing interventions classification systems are categorized in a wide range of possible treatments. The Book of Nursing Intervention Classification, 7th edition, evaluates the systems and defining over 550 nursing interventions from nurses which can choose from. There are 7 domains in which they can be picked from. So number 1 is family nursing interventions. Family nursing interventions are those that address not only the patient but other family members. They could include education for the family members about caring for the patient. And in case of new mother, interventions could consist of instructions or assist with breastfeeding and other infant care. 2, behavioural nursing intervention. These categories include actions a nurse takes to help other patients change unhelpful habits, behaviour or habits, for example, suggesting physical or emotional coping methods for a patient who wants to quit smoking. So, for example, smoking cessation. Psychological nursing interventions, 3. So Baker's interventions concerning the patient's physical health, hands-on procedure and range of feeding from hygiene to assistance. 4, psychological nursing interventions. Some psychological nursing interventions are more complex, such as the insertion of an IV line to administer fluids to prevent dehydration of the patient. Community nursing interventions. Some hospitals and clinics focus on public health interventions to educate patients, their families, and local communities. These community nursing interventions are gained through efforts and general health and well-being. For example, many clients of pharmacists are currently administering the COVID-19 vaccination, or hospitals may offer free education programs about diabetes or organise a fund run to raise money for breast cancer research. 6, safety nursing interventions. After undergoing surgery, patients need to be educated on safety procedures and protocols to prevent injury. These safety interventions may include instructions for using a walker or a cane or how to shower safely. And finally, the health system intervention. During their shift, nurses take the initiative to ensure that the patient's environment is safe and comfortable, such as repositioning them to avoid pressure ulcers in the bed. These routine procedures are classified as health system interventions. While a nurse may not use every type of intervention every day, each is an essential form and part of the care needs to be maintained, patient's physical, emotional, and mental well-being. So when we think of the key nursing interventions to perform each shift, on duty, nurses routinely perform certain nursing interventions as part of their daily tasks. In addition to educating patients about the care and the recovery and the progression, nurses will typically perform the following on each shift. Pain control, ensuring that patients are comfortable, monitoring their intake of pain medication if possible. Positioning change, promoting a change of patients' resting position. Active listening, listen to patients and repeating back information so they feel heard. Cluster care, so this informs nurses and care teams about patients' needs for each shift to help consolidate tips and avoid frequent traffic in the patient's room. Fall preventions, educating the patient, generally someone who is elderly or recovering from post-surgery, on instructions avoiding the risks of fall. And adequate oral intake, promoting fluid consumption by mouth, generally receiving fluids through IVs as a means to decrease and discontinue the IV use. So there you can see you've got pain control, positioning, active listening, cluster care, prevention falls, and fluid intake. Creating a safe environment, promoting good health practices, and listening closely to the patient are daily nursing interventions you will perform throughout your career as a nurse. If you aspire to be a nurse leadership role, such as a nurse practitioner or a nurse manager, you may eventually oversee the strategized care plans for hundreds of patients. With advanced care nursing, you can lead improvements to the quality of care and making listening a positive impact on patients' lives. And finally, there's some additional reading material there for you to have a look at, which can be uploaded. So, what we've done there on our nursing interventions, bear with me. So what we've done on our nursing interventions is we've looked at some key common areas of what nursing interventions are. And like we said, it's not all about you coming up with the best care plans in the world, but about coming up with clear and concise nursing interventions, so strategies to improve somebody's health and well-being. So that's all of the activities of daily living and all under those assessments that we saw in section 1. Equally, it could be about social prescribing, or networking or care navigating, so telling people about the right information, advice and guidance. So within nursing interventions and therapeutic interventions, it's not just about how well you can write care plans, but about the advice and guidance that you can give as well. And it's about that root cause analysis, digging down deep, you know, why are you here, what's brought you here? So whether it's physical health or mental health. And let's just look at a typical example. So you've got somebody whose blood glucose is always high. So we need to work out what's going on with the diabetic or diabetes management. Are they on the right insulin? Are they being monitored at the right times? After we've agreed that the vital signs are being done correctly and the blood glucose is still high, we now need to look at diet and nutrition. Maybe we're not eating the right foods, or maybe we're eating before we're doing glucose. So again, let's provide information and education about how and when to do the glucose. It then may be the fact that actually you dig a little deeper and you find out that they're on benefits and they're in a food desert. So they're in that place where all they've got on their street is takeaways and Just Eat and all this lot, and they haven't got access to good quality food. So it may be the case of you talking to them about accessing food banks or giving them some advice and guidance around, you know, other ways of getting fruit and veg in, and looking at different ways of doing that. So it may be the case of giving them some encouragement and support, or even just showing them how to use phone apps to order deliveries, etc. As you dig a bit deeper, it may be the fact that they're in financial hardship. So therefore, we can do some recommendations for referrals to turn to us, which is the charity around their benefits, or talking to Citizens Advice to make sure that they've got all of their benefits that they need. As we dig a bit deeper, it may be the fact that there's underlying concerns around their house and their financial security. So again, it could be the fact that we need to talk to housing and just make sure that that's all done. By addressing all of these other issues, and if we look at Maslow's hierarchy of needs and we start at the bottom and work our way up, we may actually find what the trigger is to why this person isn't eating well or their diabetes is always through the roof. It may not just be the physical and the fact that they're making poor and unwise choices, but it could be to do with underlying mental health conditions as well. So we need to think a lot more wider, and we need to probe and dig a lot more deeper. And actually, as each problem comes up, we need to find a nursing intervention or an intervention to help tick that one off and say, look, this is something we can do to support you here. Or did you know that this information is there for you? Anyway, I hope you found that useful, and I will see you in the next video.